Peter is a second-year medical student. He stays up late every night to practice for a camp. And on top of that, he has a lot of exams to prepare for. His daily routine has become very irregular.
Hey, how are you still in here? Do you know how late it is?
Oh, I just finished assisting with the rehearsal, and I'm finally tidying up things and heading home.
You must be tired. Everyone does their own work working on. Oh, I'm totally swamped. I'm heading out now. Bye.
Oh, okay, bye. Why there is so much to do. Everything peeling up. I'm so screwed. Finally got home. Let me check my list. There's no way I can finish this. Absolutely impossible. I have no choice. I gotta start now.
A few moments later. Two hours later.
Huh? It's already 4 a.m.? No way I can catch up this all. I need something to wake me up. Oh, it is spicy noodle might wake me up. Why does my stomach so bad? No, I gotta push through for entertainment. Oh, I can't take it anymore. Feels like there's a hole in my stomach. Oh, I need help. Anyone there?
Hey, Peter, what's wrong with you?
My stomach hurts so much.
Oh, don't worry about me. I will take you to the hospital right away. Sir, how can I help you today?
Lately, I've been experiencing stomach ache, along with nausea and the loss of appetite. Sometimes my left shoulder hurts too, and even just now after lunch, my stomach started hurting really badly. And I even vomited something whose color looked like coffee grounds. What could this indicate?
Okay, let me start with some quick physical exams. Your bowel sounds a little bit weak.
Oh, that hurt.
You have hypoactive bowel sounds and pressing your epigastric and hypocardial, scalding and tenderness. We think we need a little bit more test.
Peter undergoes a series of medical tests, including a urease breath test, blood test, endoscopy, and stool analysis.
Doctor, are my test results back yet? I still feel really unwell.
Your results show that you have a gastric ulcer. This is a type of peptic ulcer, meaning the lining and the mucosa of your stomach has been damaged, leading to sores or lesions on the stomach wall.
That sounds serious. Could you explain it in more detail?
Sure, let me elaborate on gastric ulcers to help you better understand what's going on and hopefully feel a little bit less anxious.
Okay.
The stomach is located just below the diaphragm, in the upper left quadrant of the abdomen. It looks like a flexible pouch, and its primary functions are to store food and initiate digestion. Its shape resembles the letter J and can change its form depending on the food intake, body posture, and even breathing. The stomach is made out of several regions. First is the cardia, which is the junction between the esophagus and the stomach, where food passes into the stomach. The cardiac sphincter plays a crucial role by preventing acid reflux. Next is the fundus, the upper portion of the stomach, which often contains a small pocket of gas that enters when air is swallowed during eating and drinking. Then we have the body of the stomach, its largest region, where most of the digestion occurs. It secretes gastric acid and digestive enzymes to break down proteins. Below that lies the antrum, which turns the partially digested food toward the stomach's acid. Finally, food passes through the pylorus into the small intestine, with the pyloric sphincter controlling the timing of food entering the small intestine. The stomach also has two curvatures, the lesser and greater curvatures, located on its right and left borders. These curvatures serve as anatomical landmarks during examinations. The inner surface of the stomach is not smooth. It displays numerous rugae, which are called gastric folds. They allow the stomach to expand and increase its surface area for mixing food with digestive secretions. From a histological perspective, the stomach is built like a four-layer structure. The innermost layer, the mucosa, contacts with food, secretes gastric juice and mucus, and shields the stomach wall from its own acid. Parietal cells here release acid, chief cells secrete digestive enzymes, and mucous cells produce protective mucus. The next layer is the submucosa, which is packed with blood vessels, nerves, and lymphatic that supports and relays signals. The third layer, known as the muscularis, powers peristaltic contraction that propel food toward the small intestine. The outermost layer, the serosa, cushions the stomach from frictions and allows it to move freely within the abdominal cavity. Together, these features allow the stomach to digest efficiently and safely. Now, you're familiar with those basic anatomy of the stomach. Let's talk about gastric ulcers and their related symptoms and signs. A gastric ulcer means that stomach acid has eroded the mucosal lining so deeply that the defect extends below the muscularis mucosa, the layer separating the mucosa from the submucosa, creating a wound that cannot be repaired in time. Peptic ulcers are mainly associated with two factors: infection with Helicobacter pylori and the use of non-steroidal anti-inflammatory drugs, NSAIDs. The typical pain from a gastric ulcer occurs about half an hour to an hour after eating. When acid secretion is high but there is no longer enough food to buffer it, it can also occur at night, around 11 p.m. to 2 a.m. When acid production reaches peak due to circadian rhythms, this pain is usually felt in epigastric region, the upper central abdomen, because acid stimulates the ulcer site and causes severe discomfort. Acute upper gastrointestinal bleeding is the most common complication of peptic ulcers. When an ulcer bleeds, digested food and clotted blood mix with gastric juices, producing vomit that looks like coffee grounds. This indicates not only a significant amount of bleeding, but also that the blood has stayed in the stomach for some time. Finally, let me analyze your physical examination and laboratory results in detail. During your abdominal examination, we noticed that your bowel sounds were faint or decreased. With a gastric ulcer, if the contents of the stomach leak into the abdominal cavity, gas or other substances can muffle the bowel sounds, making them harder to hear. We found muscles bent in your upper lateral abdominal wall. This may be caused by the ulcer perforating into nearby organs or the peritoneum, compressing somatic nerves around the stomach and causing involuntary contraction of the abdominal muscles. On deep palpation of your abdomen, we found some tenderness in the upper abdomen and under the left rib cage. This is where the stomach is located. With your ulcer, inflammation or even small breaks in the mucosa can make this area sensitive. Sometimes, the pain isn't just from the stomach itself but is transmitted through nerves, making the surrounding muscle tight and more sensitive, a phenomenon known as refer pain, which is a natural bodily response. We ran a series of tests to see how the gastric ulcer is affecting you. We checked your red and white blood cell counts, hemoglobin level, tested for Helicobacter pylori, and also did a stool account blood test. First, your red blood cell count is normal, which means your body can still produce enough red blood cells to transport oxygen and maintain your metabolism. The stool occult blood test is negative, showing that there is currently no obvious bleeding in your stomach or GI tract, which is good news. However, your white blood cell count is high. White blood cells increase when the body is fighting infection or inflammation. Because you have a gastric ulcer and tested positive for Helicobacter pylori, This bacteria damages the mucosa and causes local chronic inflammation. Your body sends more white blood cells to inflamed area to repair and defend, which is why we see this rise. This is a common finding in ulcer caused by Helicobacter pylori. We also notice your hemoglobin is low, indicating anemia. Hemoglobin is the protein in red blood cells that carries oxygen. Low hemoglobin may make you feel tired, dizzy, or pale. Even though there is no current sign of bleeding, long-term gastric ulcers can reduce iron absorption and cause chronic blood loss, leading to anemia.
Thank you, doctor. After listening to your explanation, I understand this disease much better and feel less nervous. But why on earth did I get a gastric ulcer?
There are several common causes of gastric ulcer, such as Helicobacter pylori and long-term use of painkillers and your diet or lifestyle habit.
I've been under a lot of stress recently, staying up late and skipping meals. That's why.
Exactly. These factors can easily cause damage to your stomach, but don't worry too much. With lifestyle changes and medication, you will recover soon.
Will the treatment take a long time?
Your case doesn't need surgery yet. Usually, the stomach will gradually heal as 1 to 2 months. I will prescribe you some medicine for now, but if you feel unwell, please go back soon.
Okay. Thank you, doctor. I will do my best.
From this day on, besides taking medicine on time, Peter was determined to change his lifestyle. He exercised regularly, and when experiencing a stomachache, he avoided or carefully used NSAIDs. Also, with effective time management, his grade improved too. With his healthy and disciplined lifestyle, he even found new love during the camp, embarking on a healthy and happy journey ever since.